Thanks to NAFIS for organising the session and for choosing Hammersmith and Fulham as the 2024 winners. Lynn, if you do need to stop us at any time, please let us know. So my name's Christina. I'm an information officer for the Family Information Service and local offer for SEND.
And I'm Agus, and I'm Christina's colleague for the Family Information Service and the local offer.
Okay, so what do we mean by the local offer for SEND? So it's an online resource providing information on local services and support for children and young people aged 0 to 25 with special educational needs and disabilities and their families. And it's there to meet our vision for all children, young people to lead happy, healthy and fulfilling lives and achieve their life goals. So in this session, we will discuss the series of steps we took to meet our vision during 23 to 24. We will look at our staff.
Sorry, you're on mute, Christina.
When did that go on mute? Oh, what's the last thing you heard? You're on mute, Agus.
You were talking about what the local offer means and what the local offer is.
Okay, so it's to meet our wider vision for all children and young people to lead happy, healthy and fulfilling lives and achieve their life goals. So in this session, we'll talk about the series of steps we took during 23 to 24 to meet the vision. It includes changes to the staff structure, merging our websites, and we'll also look at our current activity. Okay, so looking at our staff structure, the FIS and local offer sit within the same role. This ensures we're always thinking about inclusion and it also reduces gaps in service delivery. With the introduction of family hubs, the roles now sit under family hubs. This ensures that all information services for children, young people and families sit in one place and is not duplicated. To develop our services, we also work closely with our early years team, including the early years funding officer, our web team, our comms team, and the Hammersmith and Fulham call centre, who deal with low-level inquiries, FIS inquiries. Okay, so the website changes. In 2023, the FIS and local offer websites migrated to a new web platform, LocalGov Drupal. This enabled the website to be managed in-house. It's the same platform used by the rest of the council, and it has enhanced digital features. In 2024, the FIS and local offer websites merged with the introduction of Family Hubs to create the Family Hub website. So this is the homepage. It's a one-stop shop for information on services for all children, young people and their families. It's an inclusive website, not just through the information communicated, but the services we choose to promote on there and with various accessibility options. There's also a dedicated section for the local offer for SEND, which can be accessed at the top navigation bar on our homepage and when you scroll further down the page. To support with this transition, Hammersmith and Fulham commissioned in the consultancy company InViews. They were called InViews. So they carried out research with colleagues, local area partners and residents. And then after that, they provided us with advice, guidance and training. At the end of the project, InViews wrote a case study about Hammersmith and Fulham, which can be accessed online, and we'll share this at the end of the presentation. Okay, so some examples of what we mean by inclusive and tailored SEND content. So most of our providers choose to promote themselves on our family information directory. And as part of this, we ask those that do to provide some brief text on how they support children with SEND to promote inclusion. Another example is on our Family Hub homepage, we have Family Hub News, and we aim to increase awareness of SEND there. For instance, in April, we promoted Autism Awareness Month. The website also supports the graduated approach to SEND, so we have inclusive content to support all children, but also tailored content where parents of children with SEND can go for extra support. For example, we have childcare options for under fives guide, and within that, we have a dedicated page for SEND called Childcare Support for Children Under 5 with SEND. And within this, we've got government legislation and H&F guidance, funding to support children with SEND, support finding SEND childcare, and a link to the local offer for SEND to increase awareness and use of the local offer. Okay, so co-production sits at the heart of our web developments. This ensures it meets the needs of our residents. And one of the ways we do this is through our monthly co-production hub meetings. It includes internal colleagues and external local area partners, including parent advocates. Together, we share knowledge and feedback from residents. And there's also additional activity that goes on beyond the hub with residents. And I'll now pass you on to Agus, who has done some really excellent co-production work on the local offer.
Thanks, Christina. So as you have just heard, co-production is all about working together, families, young people, and professionals. Together, we work on content related to transitions, education, health, and social care topics. We discuss approaches, terminology, and we also have focus sessions to work on specific content. But how that looks in action. So, for example, we work with occupational therapies NHS teams and Hammersmith and Fulham social care services. We discuss online resources to avoid duplication, and then we clarify routes to access support across the board. Next slide, please. Also, for this co-production hub group, we drafted some content in relation to top inquiries coming from parents and carers. These top inquiries also came as a result from our annual SEND survey in 2023, where families with children and young people receiving SEND support and those with an education, health and care plan participated and reflected their priorities were emotional, mental health and well-being, autism, speech and language and communication needs, and learning difficulties. So we work on that content following the graduated approach. And that means that on those guides, we start with the services that are available for all, and then we include targeted and specialized services for those required higher levels of need. We focus on needs instead of services, and we structure the information in that way, using accessible headings to support navigation. So, for example, our headings show how are you feeling, what are you worried about, and we also use quotes like, I think my child needs help. So we start with those headings. But then again, how can we assure that the content that was co-produced with professionals and partners then works well for families? So, for example, about the Autism Guide, we tested their content using real-life scenarios to see how people actually navigate the info. We visit Family Hub centers and we ask centers who want to participate in testing activities for the website, and we offer an incentive for their time. Then in front of a device, we present participants with a case that can be asked, as a parent, you're worried about your child being autistic, where or who you can ask for advice. And then we ask the resident to look for the information to support that question, helping from the information they can find on the website. Then we observe how they navigate the site to find that information. And this helps us to understand whether the content is clear or if it's accessible or not, or if we need to make changes. And guess what? We did make changes following that session with families. So for example, things to do became activities for children and young people. And the for further information heading became if you feel your child is not making progress. So next slide, please. The other example we want to share with you is co-production with young people. In 2024, the local offer started joint sessions with the Youth Council that includes the Action on Disability Youth Board. It's one of our partners. And last year, in a session with 20 participants, they share valuable insights about the kind of information they want and what they don't want to see on the website. Their feedback was a key starting point for us. It got us thinking, how can we better connect the local offer content with the Youth Hub section on our website, which is designed for all young people? Next slide. And another important co-production activity we carried out last year was developing an easy-read version of the local offer annual report with People's First, an organization run by disabled people. And through this experience, we learned how to structure the information in a way that was truly accessible. We also discovered some elements which may seem clear to us, but sometimes those elements need further explanation. So, for example, what co-production means. And as a result, we made improvements to the main written version also of the annual report to making it clear and more user-friendly. Next slide. So these are some of the added benefits we identified. Co-production. We can provide tailored advice and guidance where we can ask additional questions to residents, and that help us to understand if we are missing something on the content we have. Also, co-production improves the quality of research and outreach. For example, a parent proactively signposted a provider where the Arabic community can be reached. Co-production does also highlight cultural difference. For example, during the user testing activity for the autism guide, even though the guide clearly stated right at the top that the first person to contact is your GP, when we asked participants where they would go for help, after reading the guide, some of them, they answered my church. And that made us reflect on cultural differences. Next slide.
Okay, so in addition to direct co-production, we developed the website through other forms of feedback. We have a simple online feedback form which can be accessed throughout the website. It asks users if they found the information they were looking for, and there's also an option for them to provide contact details if they wanted us to get back to them. Family Hubs also hosts Family Voices coffee mornings with residents. This is held once a term and ensures Family Hubs and the Family Hub website continues to meet the needs of residents. We also have the yearly SEND survey, which asks questions such as, have you heard about the local offer for SEND? Have you used the local offer for SEND? And it allows us to monitor trends year on year. Accessibility. So there's various ways we have improved the accessibility of the website. The primary font on the website is called Lexen Deca. It's seen to reduce visual stress, boost reading, and it's also seen to be helpful for those with dyslexia. Normally, only accessible documents are uploaded onto the website. Most of our content is actually written on web pages, which are more accessible. The Hammersmith and Fulham accessibility statement with accessibility options allows residents to request information in different formats. Residents can also report accessibility issues. There's an online form for them to do so. And as information officers, we have access training on writing accessible web content. Okay, so with the launch of the new website, we implemented an extensive marketing campaign where local offer promotion was included as part of this. At launch events, the local offer had a stall, and we also approached residents and local area partners. This included an event at our dedicated family hub for children with SEND. With our email banner, IT attached this automatically to all council staff email signatures. It was in place for 4 months and directed users to the website when they clicked on it. We had leaflets which were distributed. This included to nurseries and childminders, and the website was also promoted on various internal and external newsletters, which reached council staff, early years providers, schools, parents of children with SEND, and other residents.
Yes, and also as part of the promotional material, we distributed 500 local offer business cards to SEND partners and residents. We did that during sessions at centers and events, including a transitions fair event for young people. Also, our education and SEND teams promote the local offer through their communications with residents and partners. They also share quick local offer links and QR codes. Next slide.
So every month we put together and share a monthly newsletter to our childcare providers. It presents information in an attractive way to make it appealing and engaging. We also have a dedicated section for SEND to support providers to adopt inclusive practices. And this includes resources from organisations such as Dingley's Promise and Naseen, which were recommended by the DFE. We often pull out key points from their resources to develop interest in the topic before signposting. And when you receive our slides, you'll be able to click on our image to view an example of our newsletter. Looking at some of our key outcomes, website analysis showed some time-saving improvements and improvements to website visits, awareness and use of the local offer, and co-production activity. Inview's, who helped us to develop the website, identified some key time-saving improvements. This included a 39.9% reduction in the 39.9% reduction in the time taken to complete key user journeys, a reduction in the reading age of the website by 3 years, and 20+ accessibility issues were resolved. Website visits showed the local offer for SEND was the most visited section of the Family Hub website. This was true for summer 24 and for the year 24 to 25. We've seen an increase in the awareness and the use of the local offer since January 2023, and that's continued into 2025. And between August 23 and October 24, the local offer co-produced 47 advice and guidance pages.
Yes, also as part of our marketing and outreach plan aimed at increasing awareness of the service, last year we began attending outreach sessions at family hubs and family centers, including those located in some of the most deprived areas, where we identified greater barriers to access information. Then we started organizing coffee morning sessions at SEND schools, resource bases, special ed units, alternative provision, and also post-16 education. We also share communications with all schools and educational settings to ensure we reach every family. But we know that face-to-face engagement is especially important in areas where barriers are higher. So we have reinforced our outreach with in-person sessions. Also during the visits, we gather feedback and invite families to take part in co-production activities. For example, our new local offer poster was designed based on feedback from families at Hammersmith and Fulham schools. Also, and to further increase awareness, and because activities were identified as a top inquiry, we recently launched a Facebook post promoting a new activities section on the Family Hub website. This section includes activities for all children and young people, with a dedicated subsection for those with SEND. Next slide.
Okay, so looking at some of our next steps, don't want to overwhelm you with this slide, but essentially to say, so the Family Hub website includes our co-produced advice and guidance pages and our family information directory, which contains our childcare and our non-childcare records. And now we're in the process of developing a childcare only directory, which will be enhanced for SEND. It will make it easier for parents of children with SEND to find childcare. Co-production has already been completed on this, and we're now in the process of implementing it. As part of the changes, we assessed our existing filters, which parents can use to find childcare to meet their needs. Some of the changes we made include changes to the language of a filter for suitability. So, for instance, we previously had the name building has wheelchair access. It's now being changed in co-production to building has step-free access. And we also changed the language of a filter to demonstrate inclusion. So, for instance, the filter previously was supporting children with a list of needs. That's now been updated to focus on the experience the provider has in supporting those needs instead. So, for instance, if a parent of a child with a hearing impairment is looking for a provider with experience, they can select hearing impairment experience with rather than supporting children with. So it's more inclusive. And we've also assess the need for each filter. So, for instance, we had the filter changing room has bench and hoist. That's now been removed because occupational therapy can arrange this for the provider if it is needed.
Yes, and also as part of our next steps, we are exploring the possibility of redesigning the local offer landing page. This is to make it easier for residents to find the information most relevant, and we will consider images. This work is still in co-production.
Great. So thank you for joining us. We hope that all made sense. And yeah, free to answer any questions.
Christina and Agustina, that was really interesting. Have colleagues got questions or comments or contributions to make? Anybody got a question, Marianne?
Thank you for the great presentation and the insight into your kind of directory platforms and the structure around Family Information Service and Send Local Offer. I'm just kind of curious with your new system, Drupal. I don't know very many people who have got that system. So how have you found the engagement with families, young people, kind of the searching element? I know you kind of gone through the searching element, but when you moved from your previous system to this system, how was the transition, and how did young people and parents feel about the transition?
So we just found the platform really, it was more user-friendly and helpful, and we were able to manage the website better. And the problems that we had before, even with our Ofsted feed, we didn't have those sort of problems anymore. It just felt like a new clean system to do. So migrating to LG Drupal, yeah, we found that really beneficial in so many ways. And then afterwards, merging the websites together.
Also, when we merged sites, we did that working with a consulting company in Views that Christina mentioned during the presentation, and they organized some workshops and co-production sessions with families and young people. They were involved during the process of the migration. So they were asked, what would you like to see on the website? What are you expecting to find on the website? And that is part of the report that Views prepared for us.
Do you
We
also
just found
find,
it, yeah.
Sorry, do you also find that the childcare providers and the other voluntary providers also engage with the platform, and are they encouraged to update their information? Because obviously with the FIS and the new policy change that's due to come into effect, how have you found the engagement with the childcare providers as well to encourage them to provide the updated information on the directories?
Sure. So we updated it just with the childcare providers, we saw an increase in our page views with with the new website. We saw a big increase, especially with our promotion. And with engaging providers, I think it can always be difficult to engage providers. So to help them update the information, because they're not always proactive to supply information. So it does involve a lot of work to engage them. So emails, telephone calls, and we know it's important to do so. So it's not compulsory for them to advertise on the Family Information Directory. It's an option, but if we do, they have to complete information a certain way, and we wouldn't just let them update their information there. It would be reviewed by us to ensure it's inclusive, it's easy to read, but obviously that takes a lot of work. And because they have, as you know, they have to advertise their costs with the changes in the guidance. So through that engagement, we do inform them to inform us if their costs have changed, but also we'll have to do those periodic
Updates.
we have to reach out to them as well to encourage them to do so, because essentially their focus is on, you know, their practical work in the nursery, IT, updating records, you know, they don't always have the time for that. So there's a lot of work from our side that we have to do to encourage them to keep those records updated, and especially moving on to the childcare directory. That's even more important, and we're hoping the childcare directory looks because it will be easier to use and navigate. And through the relationships we've built when we actually speak with the providers, we're hoping to see an improvement in the childcare records being used. Does that answer your questions, Mariam? Did I miss anything?
You've answered it. Thank you very much.
Okay,
Thank
cool.
you.
I think we've got a question waiting from Sarah and then a comment from Rosalind after that. Sarah, do you want to go ahead?
Yeah. Oh, sorry, I'm outside on my phone. Thanks for a really interesting presentation. Can you hear me?
Thank you.
Yes.
Yes. Yeah.
Oh, brilliant. Thank you. I just wanted to ask about engaging young people. I have good relationships in West Sussex with our parent carer forum, but we find it more difficult to engage young people and you know, those teenagers up and young people up to 25. How have you managed to go about that?
So we joined the youth council sessions that are already taking place in the borough, and we sometimes, you know, take the opportunity to attend some of the holiday clubs that Action on Disability, one of our partners, organizes and run. So we attend those sessions because we know we will be working with young disabled people, and we test pages with them. That's the most practical example that I can share with you.
Okay, thank you. That's really useful. We're we're using Drupal, so we're currently transferring our corporate website to using Drupal. So I'm really encouraged by what you said about the positive aspects of that. Thank you.
I find engaging for young people also, you know, when you want to implement new tools like videos, podcasts, so they really engage with that kind of elements, and we are looking to implement those on the website.
Lovely.
Yeah,
Thank you very much.
Yeah, LG Drupal gives us that flexibility to add these different types of media, and yeah, it really empowers us to do what we want with the website. Also, we have very good, strong links with our web team. We're in contact with them nearly every day, and they work hard on developments. And currently with the childcare directory, we'll be having a map as well. So with the filters, you can see it would just make finding childcare so much more useful. And also on the point about engaging young people, we also have close links with the youth coordinator. She sits within family hubs as well. So yeah, we all work together to engage young people as well.
Lovely. Thank you.
Sarah, I think Rosalind has a question about the childcare only directory. Rosalind, are you there? I'm not sure if Rosalind's still.
Yeah, no, I am here. Sorry, I was just having trouble unmuting. I was just wondering, you may have said this and I missed it, apologies, but I was just wondering, you said you were planning on separating the directory out for a childcare only section. I was just wondering what the reasoning behind keeping it separate from the activities, etc.
Sure. So it will help us to manage our childcare records and the Ofsted feed better. Currently with our directory, there's lots of filters. Whereas if you just had a childcare directory, it's easier to use, it's easier to navigate. There'll be maps, there'll be different features to our community directory. The community directory is an initiative to bring directories within the council together into one directory, so you haven't got as many records. So overall, if we did that for the whole council, it'll be quite big. But when you do it, when you just focus on childcare, you know, we have our set filters there, and it just makes it more manageable. Childcare is such a big thing with the childcare expansion. Families want to find childcare in their borough. So if you had just one port, then it's easier. And again, it's easier to, with the Ofsted feed coming in and then updating those records, it's easier. It'll be easier to find and easier to manage. So, yeah.
Okay, brilliant. Yeah, that's helpful. Yeah, we're in the process of sort of redesigning ours at the moment. So yeah, it's just something to think about. Thank you.
Yeah, you're welcome.
Thanks, Rosalie. Anyone else? Any questions, comments, thoughts?
So I have a question. Don't want to ask myself a question, but just to put out to anyone else, I'm aware that some local authorities use software, an AI tool called Hemingway online, to help them to produce easier to read, to reduce the reading age of their content. I'm just wondering if there's any other tools that other local authorities use to improve their web content to reduce the reading age, because we're able to see all our pages and the reading age of those pages, and just wondering what other local authorities are doing.
So
Mary?
Yeah, so as here in Hounslow, we do use the Hemingway app. We put everything through that, but we also have oh gosh, what's it? It's called Monsido, and it scans for any broken links, any spelling mistakes, but it also tells us the reading age of each page. So it'll give you everything from college graduate up to the easy reading. So it is a matter of, they give you a list and then we go in and try and make it as simple as possible to read. So it's looking at the reading age, but then it's also looking at words, looking at the construct of the page. Like you said, you've had training in it, so it's about breaking the text up, putting things into bullet points and things like that. Yeah, it's a long haul because you've got so much else to do, and then you think, oh, let me try and simplify a page, and that can take you forever trying and everything. Yeah. Not easy, but at least you with that. I think they changed their name recently. I'm just going to get it. So it was Monsidia. It's Acquia, ACQUIA. Optimize it's called, but it's very good, even just for and plus it tells you how accessible your pages are as well, and it'll tell you where you sit within the accessibility whack and it RACAT. Though I can't speak today, so sorry.
So Mary, do you pay for Hemingway? Because we have the information about what we need to do, but then to get it into that format, to make it so much easier to read and reduce the reading age, that's the bit where we can improve. So yeah, do you pay for Hemingway?
No, we just go for the unpaid section of it. And then we do use AI sometimes to look at the words, but then that makes it even longer because it will just try and make it American. It is a matter of I have double screens. So I have two Hemingways open, one with the original text on it and the other one that I play with, because sometimes it can get really messy. I haven't found an easy way of doing it. So I'd be, happy to hear what other people do as well.
Thank you, Mary.
And I'm loving the site, by the way.
Oh, great. Yeah, the links are on the first slide. Yeah. There's still a lot of work to do. This isn't a final product, there's always so much work to do because yeah, there's a lot of things to consider with children, young people and families.
Christina, I think we've got a comment from Anne Jordan. Anne, are you there?
Hi, yes, I'm here. Our setup's a bit different in that we have sort of a website team who add the content to the local offer, add the content to whatever sites, and wait for content to come in from services and what have you. So it's, do you add the content yourselves to the website, or is that the web team? And then also, do you have a budget for attending sessions with parent carer forums, etc., and a budget for leaflets? Because we have absolutely no budget at all. So it's it's how do you deal with all that?
Yeah, so sorry, just repeat the first bit of the question again, sorry.
Do you add the content
Oh, yeah.
yourselves to the
Yeah,
website, or is that
So,
the web team?
we develop the content through our co-production sessions, and then for the advice and guidance pages, we give it to the web team to add the content, because if it was left to different individuals, it can look inconsistent throughout the website. So that's why our web team do that. But for our family information directory, the provider records, we're able to add it ourselves, and then the web team will review it before it goes online. So that's that part of it. And sorry, the second part of the question again?
About budgets. So
Oh, yeah. So because we sit under family hubs, a lot of the promotion is done as a whole for family hubs. So it includes family hubs, and family information, as you know, is very close, but it includes the local offer budget. So yeah, we do have a budget for promotion. It can vary every year. So when we launched family hubs, there was quite an extensive budget to increase awareness and really get the word out. And so yeah, we have a smaller budget this year where we can update leaflets. And then I guess for the local offer, is there any more?
Yes, as Christina mentioned, because we have a joint marketing plan for all family hubs, and that includes the family information service, family hubs, the settings itself, and also the local offer. We join the budget, but we assign some, money for specific implementations, for example, to print some of the promotional material. But also, for example, for the Facebook post, what we did is we ran the post joined with Children's Commission. So we split the budget, so you can also do that as an option. We try to, understand who else in the council has the same audience. And once we identify that, we ask for some collaboration with teams. So we run joint campaigns.
Yeah, so with the holiday activities and food program, that sits within commissioning. So we had a joint budget with them for their activities promotion on Facebook. And also with our early years team, I believe we'll have a joint budget for the entitlements promotion.
And
so
depending on the session or the event, if we join a partner session, probably we don't need to assign budget for that, because the facility is already there, organized by the partner or who is hosting the event.
Okay, that's fab. Thank you very much.
Sorry, I want to add something. What we do, some budget, it's also for incentivize people for the testing activities. So for that, yes, we are using a £10 Amazon voucher or £5, depending on the occasion and the time that the people need to invest on us.
Yeah, I think that's a really important thing to use incentives when we're doing co-production with some of our residents. And they're always really grateful for that. And it doesn't have to be anything big. Like I could say, it's like a £5 voucher, Amazon voucher. Yeah.
But you actually have a budget for that?
Yes.
Yeah. Okay, cool. Lovely. Thank you very much.
Thank you. Anyone else have a question?
There was another question in the chat.
There's something from Sarah, another one from Sarah. Sarah, are you still there?
Hi, yeah, I'm still here.
Thank
It was more
you.
really because I'm quite new in post, and I just wondered if there was either a group of the local officers that got together, I don't know, termly or something, to have a meeting like this to talk about how we're developing the local offer. And if there isn't, I'm happy to organise, and would anyone else be interested in putting something together? I don't know if there's anything sort of going on at the moment with that, but I think it might be useful, certainly to me, maybe to others.
Sarah, I've just put something in the chat as well. It's Marion from Reading, and I co-chair NAFIS as well. There used to be a group many years ago, and we all had our regional groups, local offer regional groups, and we had a national group as well. But I think once the local offers were very much embedded within the SEND code of practice requirements, the groups kind of almost disappeared. So it'd be really good to kind of start up a local offer kind of working group. A lot of them were called working groups. As kind of they were around the people that were actually involved in the promotion, the directory, the engagement, the co-production side of things, rather than kind of the strategic leads around the SEND program. So I think it'd be really good to set something up, and maybe that can be sent out through NAFIS to our colleagues, and just see how many people are interested in joining.
Okay, that's really useful. Thank you. So if I do that then through NAFIS, and ask them to send that out, and then maybe if people are interested, we can work something out to get together, maybe termly or something, just to talk about how we're doing. It would certainly be useful for me. That's really useful. Thank you.
Just to come in, yeah, thanks, Sarah. Just to come in on that, this sort of idea has been floated in another place as well from other NAFIS members in terms of people who are specifically working on local offer. So yeah, we're looking at it, but we could certainly facilitate an initial discussion meeting and see how many people are interested. Be happy to help. So maybe we can talk outside the meeting, Sarah, with Marianne as well.
Okay, thanks very much for that.
We've got any other comments or thoughts or contributions, and other people want to contribute how they're running their local offer, or learnings you've had from improvements you've made at all? Any other comments or questions? No, I think that's, if nobody's got any other questions, I think that was it's perhaps timely to finish a little bit early, but to say thank you so much to Christina and Agustina. You've really achieved a lot, and it was great to hear the measures and the outcomes, you know, that you'd looked at what had changed after all these developments, and you know, you've looked at the user experience all the way through this project, and started with your audience first and the needs of the families in Hammersmith and Fulham who have children with additional challenges. So, you know, it's fantastic to see that you've brought that alive in the communications work and in the website. You've got a lot to be proud of in the work that you've done, and thank you for sharing it with everyone here today. So I'm sure you'll all join me in thanking our colleagues from Hammersmith and Fulham. Thank you very, very much, and we will be able to share the slides and the recording in a day or two after today's session. So thank you very much.